What's up, vets? Military, y'all saw the thumbnail. Now let's get into it. So, you keep getting denied for your secondary claims for a few reasons. Let's go through the scenario. You're like, oh, shit. I figured out, my buddy Vet X over here, he got secondaries up the wazoo on just a 10% rating. He went from 10% to 90%. He had a migraine, sleep apnea, whatever the case may be. He got 30% for migraines, 50% for sleep apnea. And then you go ahead, submit your claim, try to do the same thing. Probably got a diagnosis of migraines. That's probably all you have. Probably got a diagnosis of sleep apnea. And it's okay, I got a diagnosis. I'm a vet. Let me just plug it in where I see fit. And then there's some vets who go and they pull medical literature, acting like they're doctors. Okay, cool. That's all cool and dandy. But whenever you submit that claim, the VA is mainly looking for causation and complaints. If you're not doing neither one of those, deny right off the bat. If not within a week, it may get denied 9 months from now. And you're over there waiting like, can't wait until my CMP exam. So, first thing, complaints. If you're filing a secondary to anything, the VA they're looking for has this veteran complained about their service-connected disability causing this secondary disability in which they're trying to seek, VA benefits for. Let me look at your profile. Let's take, sciatica secondary to low back strain or cervical strain. Has the vet complained about it? You got Vet X over here. Yes, they complain about it at least once a month. They've been seeking chiropractic services. They've also been in physical therapy. Vet, Y over here hasn't. They brought it up once, and that was it. They submit their claim. The VA looks at both veterans. They see one veteran over here. They have multiple complaints. They even have some treatment options, or some treatment that they've actually sought through chiropractic and physical therapy. You got the other veteran over there. They have one complaint that was 5 years ago, and they figured out, okay, my buddy got service connected for it. How about me? No, the VA, they're not going to service connect you. They're going to deny that claim outright. So the way you do this, complain. Even if you figure out about a disability, migraines, insomnia, sleep apnea. Right now, sleep apnea is the main one for a lot of veterans. Just because they have a diagnosis of sleep apnea, they could just plug it in as a secondary anywhere. And it's a good secondary to respiratory issues. However, if there's no complaints, establishing the causation, hey, my asthma, my rhinitis is causing sleep apnea. My tinnitus is causing sleep apnea. My PTSD is causing migraines. That's another, not going to get too deep into that. But if they're not complaining about it, you're not going to get service connected for it, regardless if you have a diagnosis or not. The second is causation. Through your complaints with your doctor and through your medical evidence, can the VA clearly see that your PTSD is causing migraines? Your tinnitus is causing migraines. Your low back pain is causing issues in your knee. Your feet, your service-connected plantar fasciitis is causing issues in your ankle, in your hips. Can they see the medical causation through your complaints and your collaborations with your primary care provider? If they can see that, more than likely, they're going to call you in for a CMP exam just to get a little more, warm and fuzzy. The CMP examiner, they're going to call you in and they're going to ask you, what's going on. Most vets try to bridge, for a secondary claim, they try to build a bridge back from their active duty time. That's not the way to do it. That's not what a secondary disability for the VA is. A secondary is at what point in time did your already service-connected disability started causing a secondary disability. You start at that point. So like a lot of veterans, they take PTSD medication for months, years, whatever the case may be. And some of the residuals of, or some of the side effects of taking PTSD, post-traumatic stress and post-traumatic stress disorder medication is stress eating, increased anxiety, excessive weight gain. In terms, that excessive weight gain and that stress eating turns into respiratory issues. Cause you have a motherfucking fat neck, which causes sleep apnea. There is clear medical literature on that. Now, the only way you can get that, causation is you working with your primary care provider or your physician, your primary care provider. They give you medication for PTSD. They've noticed, in the last 7 months you've gained 40 pounds or 400 pounds. Who knows? I'm just letting y'all know. But if you gain weight, there's recording, there's documented logs. More than likely, you're gonna be going in, frequently, especially if you're taking PTSD medication and you're seeking therapy on a regular, routine basis, maybe once a month, maybe once a week, once a quarter, wherever the case may be. There's gonna be a documented record of you coming in. They take your blood pressure, they take your weight, some other demographics and stuff like that. But at bare minimum, they're gonna be taking your weight. So there's going to be a record of a gradual weight increase or an excessive weight increase. You came in January, you was 200 pounds. Then you came in, March, you was 250. What happened? What happened, veteran? It's okay, well, the only thing that's changed is I've been taking this PTSD medication. And I've noticed I've been eating more. Which caused me to gain weight. Which has caused, in turn, sleep apnea. As well as it could cause, high blood pressure. And things of this nature. So, whenever you're submitting claims for secondary disabilities, you need to follow, the VA needs to be able to identify and follow your complaints into a causation, which leads to that diagnosis and which leads to service connection. It's not hard, but a lot of veterans get it confused. They think just because they're a veteran, they're service connected, they're at 90%, They figure out about a high value VA claim, high value VA disability, and they decide, fuck it, let me just throw some at the wall, see if it sticks, and then they're wondering why they keep getting denied for the next 2 or 3 years. On top of that, if there's any reason for denial, read the decision letter. Most of your complaints, most of your issues lie in the decision letter. If it's for a secondary, maybe one of the only things that's missing is a clear link to the service-connected disability, which is the causation. How is that service-connected disability causing this secondary disability in which you are trying to file a claim for and get benefits for? But if y'all like this type of content, y'all know what to fucking do. Hey, stick around. Always on live. I've been going live a little bit more frequently. Coughing live. Until next time, this motherfucking Debo out. Hope y'all fucking stay Gucci with it. And remember always, 2023 year to bet.